Hospitals are places of healing. We go there to get better when we are sick or injured, but hospitals can also be places of unexpected danger. One of the most common yet preventable dangers is falling. Falls can happen to anyone at any age, but they are a particular risk for people who are already unwell.
Falls in hospitals are more common than you might think. They can lead to serious injuries like broken bones, head injuries, and even longer hospital stays. It's important to understand why falls happen and, more importantly, how to prevent them. By taking simple precautions, we can all contribute to a safer environment for patients, families, and hospital staff.
There are many reasons why falls are more likely to happen in a hospital setting. Patients are often in unfamiliar surroundings. They may be confused due to illness or medication. Their mobility might be limited due to surgery or the condition that brought them to the hospital in the first place.
Age is a significant factor, as our bones become more fragile as we get older. Your medical history matters too. Conditions like diabetes, heart disease, or problems with balance can increase your risk of falling. Certain medications, especially pain relievers or those that affect blood pressure, can make you dizzy or lightheaded. Even the hospital environment itself, with its long corridors and sometimes dim lighting, can contribute to falls.
The good news is that many falls are preventable. The first step is awareness. Patients and their loved ones should be informed about the risk of falls and educated about simple safety measures. Hospitals can provide information through brochures, posters, and videos.
One of the simplest yet most effective things a patient can do is call for help. Every hospital room has a call button. Never hesitate to use it if you need assistance getting out of bed, walking to the bathroom, or reaching for something.
Remember, asking for help is a sign of strength, not weakness.
Hospitals use a combination of technology and teamwork to prevent falls. You might notice patients wearing yellow armbands. These are visual cues for staff, indicating a higher risk of falling. Non-skid socks are another simple but effective tool to prevent slips. Hospitals also use bed or chair alarms that sound when a patient tries to get up without assistance.
Nurses and nursing assistants play a vital role in fall prevention. They conduct regular checks on patients, known as hourly rounding, to anticipate and address potential needs. They assist patients with mobility, ensuring they have walkers or canes within reach, and they assess each patient's risk of falling using a standardized fall risk scale, which guides the level of precaution needed.
Let's imagine a scenario. A 70-year-old man, Mr. Smith, is recovering from hip surgery. He is eager to regain his strength and independence. However, the combination of pain medication and the unfamiliar hospital environment puts him at risk. One evening, feeling dizzy, he tries to get out of bed unaided and takes a tumble. Thankfully, the bed alarm alerts the nurses, who respond immediately.
Although shaken, Mr. Smith is found to have no serious injuries. This scenario highlights several crucial points. First, even with precautions, falls can still occur. Second, prompt response is essential to minimize harm. Third, every fall, even without major injury, is a learning opportunity. By reviewing what happened, the care team can identify any gaps in the fall prevention plan and make adjustments to prevent future incidents. Do self-checks using STAR.
Pay attention to detail, minimize risk, stop, pause for a moment to turn on bed alarm. Think, make sure patient has call light. Act, answer to call light and alarm promptly. Review, check to make sure that the task was done correctly. By understanding the risks and taking proactive steps, we can create a safer environment for everyone. Remember, fall prevention is a shared responsibility. Patients, families, and healthcare providers must work together to reduce risks and promote healing.
If you or a loved one are hospitalized, don't be afraid to speak up about fall prevention. Ask questions, voice concerns, and actively participate in your care plan. Remember, your safety is the top priority. By working together, we can make hospitals safer for all.